So if I wasn't in healthcare, I had a lot of money, I probably would have I would have gone to Washington, and I would have been working with lobbyists or somebody, because that's very exciting. It's just that call me crazy, I wanted to get a salary. When we're able to work with a population and their A1C counts are over 15, and all of a sudden, after working with our team over a year period, and the A1C numbers are down to almost the single digit, that shows that we're really helping the health of that population. And we're helping those members throughout the experience because they feel like they have somebody on their side.
Today, I'm joined by Caryn Rasnick, who's a longtime leader in the self-funded healthcare space. She spent over 3 decades across health benefits administration and TPA operations, and she's currently the Vice President of Health Benefits Administration at Northwind Health. Caryn, welcome to the show.
Thanks so much. Happy to be here.
So, Caryn, I understand that self-insurance is something that you were exposed to pretty early on through your family. So can you talk a little bit about your family's involvement in the space and how that led you into the industry?
My family entered into this industry actually in the early to late 70s, and we started our first TPA back in 1982. In 1982, I was 13 years old. So, as a child of an owner of a TPA, you are immediately thrown into help out in any way that you can. Yes, I've been in the industry for a very long time. Family has started and sold 2 TPAs over that course of history, and I've learned every element of a TPA during that time period.
What made you stay for so long? Obviously, you could have done anything else.
Sure. So to be perfectly honest, I graduated from college with a degree in poli-sci and international studies, and I went, "Oh my gosh, I need to get a job." So at that time, Cobra and Flex were coming about, and the president of the TPA of Illinois, which my dad had sold to Travelers Insurance Company, he asked me if I would stay, and I jumped at it. So then all of a sudden, I got involved in the inner workings of a TPA from an operational, marketing, sales, and account management perspective, and it just was something that really resonated with me, and was much more exciting than getting into the world of Washington politics. So I decided to stay in the TPA side of the industry instead.
And you recently joined Northwind Health as a VP of Health Benefits Administration. What opportunity got you excited to make that move?
Sure. As things happen in the industry, there are always different paths that you can take. When Northwind presented me with the opportunity to take over their TPA operation for the current president, who is retiring in May, I jumped at it because it's still an independently owned TPA. And while I appreciate all of the TPAs that are owned by insurance carriers and by private equity firms, I have a passion for the entrepreneurial environment. And I truly believe that we can do so much more when we have the flexibility and the ability to just pivot when we need to, because we are an entrepreneurial organization.
And what are you aiming to build there? What are you excited to work on?
I'm really excited to bring the TPA operation up to a new level and really build on what Carolyn Jursky has already put in place for the last 20 plus years, and really expand upon it. So, be it new operational efficiencies, new vendor opportunities, new abilities to interact with the rest of the Northwind Health product line that will really bring together the entire member advocacy programs, and really working with disease management and trying to catch those um, claimants before they ever become a large claim. So trying to pull together the full TPA perspective and to build on some of the really standard building blocks of what makes a TPA so special.
I want to talk a little bit more about that member advocacy piece that you mentioned. I think we've seen, thousands of apps, tons of different ways that people are trying to get their members to engage with their health plan. And I think it seems pretty low. Obviously only a small percentage of the membership actually is utilizing the health plan at a high rate. And so would love to hear if you think, is AI going to be the next generation of things that actually make interaction with the health plan much higher from a member perspective? Or what do we need to actually make that happen?
It's a um, multi-tier focus, right? Because you need your AI and the chatbots to assist members who want to work with you in that fashion. But we have a wide spectrum of populations that we have to deal with. We're dealing with all the different generations, some that want to talk to you on the phone, some that want to talk to you via a chatbot, some just want an answer and don't care and don't want to pick up a phone, some that don't want to feel like Big Brother is looking over my shoulder, right? So you have to meet the member where they are. Member engagement, I think, is also a part of the carrot and stick approach of how you write your plan. And one of the things that Northwind does extremely well with our Blueprints program is that we're using the prescription drug data that is coming out from the members' utilization. We're then having our advocates reach out to those members to help them understand exactly how their program works and what we can do to help them navigate. So it's nurse case managers and coaches who are working with those members to assist them with their needs. And for example, when we're able to work with a population and their A1C counts are over 15, and all of a sudden after working with our team over a year period and the A1C numbers are down to almost the single digit, that shows that we're really helping the health of that population. And we're helping those members throughout the experience because they feel like they have somebody on their side who's working with them and isn't somebody that is penalizing them, right? I think the hardest thing for a member to deal with is when they feel like I'm getting my hand slapped because you're telling me that I don't live my life the way that I should be living to meet the needs of the plan. So we have to turn that around and help them understand that we're trying to help them help themselves so they will continue to be there and thrive for their family and for themselves as their diagnosis continues.
So I know you've worked across multiple areas of this self-funded ecosystem. I'm curious to hear on your take on what do employers seem to be most concerned about right now? Has it always just been trying to figure out a way to cut costs, or do you find that sort of the member advocacy story is a really big push? Are there other things that sort of help you close an employer account or move them over from a fully insured plan, or outside of cost, or is it really just cost pressure?
Depends on who you're selling to. So if you're selling to the CFO, they're going to spreadsheet you, right? He doesn't care. She doesn't care what the overall benefit plan is, how many of your employees are happy. They're literally looking at a balance sheet item, right? So they're looking at that. If you are selling to the HR person who is struggling with my employees can't find a doctor to go to and that my deductibles are too high or things of that nature, that's a different sales proposition. So you have to know who your audience is to know what the right skill set is. Now, as it relates to what resonates most of the time with most of the clients, this is where the data is really important, right? Is where are your highest costs coming from, and are they related to something that you can help manage? For instance, the big item that's out there, right? GLP-1s. We're all hearing about it. People are getting the diagnosis of type 2 diabetes so that way they can all of a sudden be on the GLP-1s because most plans don't cover it, weight loss medication, but they will cover it if it's medically necessary. That comes into play. So how do you work with your benefit plan? How do you make sure that people are helping themselves? How do you structure the plan to streamline them into products and services that will help them get healthier so maybe they don't need to be on those medications forever? But obviously, specialty drugs is an area that is extremely focused right now because of the dollars associated with it. The new drugs that are coming out, they're more expensive than ever. Gene and cell therapy is a potential risk that's out there. But ultimately, you need to be aligned with a strong TPA and a strong benefit consultant who can look at the data to make a determination of, is this vendor product, third-party product that's out there, is it something that truly is going to affect my bottom line, or is it just going to make it more difficult and cumbersome to the member experience? Because if I don't have a plan that has a high level of musculoskeletal issues, then why am I going to implement a third-party vendor that's going to help reduce those types of claims? You have to know your plan.
So help me understand that on the specialty drugs piece. If I'm an employer and all of a sudden in the past 2 years, I see that, a small portion of my employees are now on these hugely expensive specialty drugs and it's completely rampaging my cost structure. What can I actually do as an employer? How can the TPA help me there?
So in that kind of situation, you need to know where the experience is coming from. You need to analyze who are the members that are utilizing it, where has it changed, and then you need to work with your broker consultant and your TPA to identify programs that could potentially get involved. For instance, like at Northwind, we have a GLP-1 disease management program where the nurses are working with them and trying to get people to be able to wean off those GLP-1s. GLP-1s without the physician review is something that is extremely dangerous because a member needs to be managed by a medical doctor, a pharmacist, somebody who can work with them to make sure that they are actually progressing the right way. I had a recent situation where there was an 80-year-old man who was determined to be type 2 diabetic and was quote unquote an obese, 5'10", 195 pounds. He was put on a GLP-1 without any interaction from his medical doctor, went down to 161 pounds.
Wow.
Too fast in literally a 2-month period. And during that 2-month period, what he lost was not only fat, but muscle that he needs as an 80-year-old man to be able to thrive and not get sick. And then other comorbidities happen. So it is really important that you implement programs that can work with those members, because what you don't want to have happen is what happened to this member. Wasn't a client of ours. This is purely a personal relationship that I'm aware of. And he wasn't managed, and yet he wound up in the hospital. Now, if he had been managed, he wouldn't have wound up in the hospital.
Always helps to have sort of a strong indication of a personal story of somebody that goes through that, so you can actually see the outcomes of what happens when patients aren't managed correctly. And I want to think a little bit about, these programs that you guys are talking about. Obviously, as a TPA, you're sort of the orchestrator of everything going on. How to decide between programs that you guys are going to build internally versus that you're going to partner with other vendors on?
I'd love to be the expert on everything that's out there, but the fact of the matter is you just don't have that opportunity. And I believe that as a TPA, we should be creating partnerships with vendors who are best in class in what they do, right? There is no reason for me to be producing ID cards in my own shop, right? I should be outsourcing that to somebody who does that, who efficiently, effectively, the cost of goods and services is it's much lower for them to do it than it is for me to do it, right? So those are the cost benefit analysis types of decisions that you need to make as an organization as to what you're going to implement, how you're going to implement, and what type of results will that vendor have on your block. So I don't think that you should be everything to everybody, but you should have the ability to decide on what partnerships will make you very valuable to your prospects, right? And to your clients, and what other added value can you bring to the table? It's really important. I don't believe that it's just the benefit consultants and agents that should be reviewing the data. I believe that the TPA account managers should help deliver the story and help deliver the solution, because there are 1,000,001 solutions out there, but you need to find the right solution for the right partnership.
So every person that I speak to says that we're in point solution fatigue. So asking you that same question, if we are in a fatigue, how do you then decide which vendors are the best in class ones and who you
Mhm.
want to move forward with on any particular service that you're looking to implement?
Well, first, it has to align with your strategic plan and vision. So that you have to decide. Are you going to be everything to everybody? I worked with a company that implemented 41 different PBMs on January 1 a few years ago. Is that a value proposition for that TPA? Maybe they were trying to write a bunch of business and those cases were brought to them and said, you have to implement that. Where we need to decide if that's the way we want to go based upon the cost benefit analysis. There is a cost to implementing all of those vendor integrations. So if I could, for example, Northwind has a PBM arm as well. I will have clients that have Northwind as a PBM and clients that don't have Northwind as a PBM. But maybe my product offerings can be more aligned and be a premier product that has the Northwind family of products and services, because we're all tied together already with our data. Whereas other vendor partners, you have to decide what is that cost analysis going to be to link with them, Will you get your return on investment? Will your clients get their return on investment? I think that's important to take into account. But ultimately, your strategic vision as a TPA as to who your client is and who you want to be is very important to decide then which partners you're going to look at and how you're going to implement them or as them. Do they add value to what you're offering?
Have you ever seen an implementation go wrong firsthand?
Absolutely. So implementations can go wrong if expectations are not managed all the way across the board. We're talking client expectations, vendor expectations. You know, when I'm meeting with vendors right now and I'm interviewing them to determine what they can do for me, and the question that I ask is, and when can I get this implemented? Just because I sign an agreement doesn't mean that they're going to be able to flip a switch and get it implemented. If you're working with multiple entities to try and get something implemented, there may be a lot of time that you didn't realize that you needed to have. Plus, we have to account for the fact that there are times when there's a miscommunication because, you know, nowadays we send a lot of emails and don't pick up the phone or don't have a Teams meeting. And what I may be communicating to you, you may be interpreting as something completely else. When that happens and there is a disconnect and all of a sudden you're going through final testing phase and you're like, well, that isn't what I asked for at the beginning. Well, you didn't realize it. You're already 2 months down the road and now you have to start over again. That can be difficult. So you need to make sure communication is very clear, intentions very clear, and expectations of what it means to go live and what it will look like on that date when you go live, that has to be managed. What I like to do with implementations is work backwards. Ultimately, I work with the client to say, okay, we're going live on this date. What do we need? And work backwards and say, this is where we have to start, right? And then you need to have your ongoing project management meetings. The same thing with a long, long time ago in a former life. I was an account manager for a very large, well-known food chain that had over 10,000 employee lives. We worked with them to determine how they wanted their reporting. Ultimately, the implementation was based upon how they wanted their reports to come out. You have to work backwards. It ended up we needed 180 different plan designs to load in the system so they could get reporting in the manner that they wanted it. Now, mind you, that was the 90s when we didn't have all of this AI and Power BI and things of that nature, so it would be a lot easier in this day and age. But those are all important discussions to have. Communication and management of expectations, number one and number two, in priority as it relates to implementation.
What is the AI story today at Northwind? What are you most excited about? Are I'm talking to a ton of people who are doing AI in the member experience side, building chatbots that members can talk to learn more about their plan. Obviously, a company like us, we do AI on the payment integrity side. There's so many different opportunities. Where do you see the most tailwind for Northwind?
For Northwind, I think it's going to be a combination of all of our products and services, be it the Northwind clinical blueprint product aligned with our PBM and with our TPA services. It's a full, complete package that will follow the member experience all the way. So the TPA is going to process the claim. The PBM is going to have the very transparent pricing to be creditable, and the disease management component that works with our member experience. That full package is really, I think, going to set us above and beyond the other TPAs. I'd also like to say that because we are an independent TPA, that is something that is attractive to brokers that are out there that have been having operational issues with other larger TPAs. We're a smaller TPA, so we have that ability to really focus and have the clients be the primary focus. I think one of the hardest thing that our industry is going through is with the growth and the consolidation of TPAs. There are a lot of operations that have been more focused on reduction of cost of goods and services instead of the full member experience. And when you base all your decisions based upon KPIs alone, that takes out what made our industry so great, which is the people who are the ones that the clients rely on. For example, I know at my former TPA that my family sold, that TPA still has clients on the books that have been there for over 25 years.
Wow.
what I want to create with Northwind is to establish that type of relationship and respect and trust with our clients that they know that they can be with us for that amount of time. And then, it's not just a spreadsheet, it's a relationship. So you have the ability to work together.
I think it's so beautiful, the types of relationships you can build. I think it seems like this industry is completely run on relationships almost, just given how sort of sensitive the topics in nature are.
Yep, it is. It is a very much a relationship business, and it shouldn't be reduced just down to KPIs.
If you weren't in healthcare, what would you be doing?
So if I wasn't in healthcare, and I had a lot of money, I probably would have gone to Washington, and I would have been working with lobbyists or somebody, because that's very exciting. It's just that, call me crazy, I wanted to get a salary.
Who is the worst middleman in healthcare?
The worst middleman in healthcare is the one that, I'm not going to put a finger on any one person or product or service, but it's the one that takes the relationship out of the equation and converts it down to just a spreadsheet or a number. And that person does a disservice to both the customer and their partners.
What do you think people misunderstand about you?
I am very strong in thought and word, and sometimes my directness can be misconstrued. I don't want everybody to like me. I want to create a culture, is my intention, especially with my employees, to make sure that they understand we have an open door culture, or in this world of Zoom and Teams, we have an open monitor culture. But I want to be approachable. And sometimes people are afraid by my direct nature that they can't approach me. And that would be a false statement.
Well, that wasn't my experience when I met you, so I don't think everyone thinks that.
That's good. I appreciate it. I do my best to come across as well as I can be. Sometimes my dad always used to say that I wasn't fuzzy enough. And I think with my operational brain, I think in bullet points a lot. So that's how I can be direct in my communication pattern. And sometimes I just need to be a little bit warmer in my.
That's a wrap on the podcast. Thank you so much for joining. It was such a pleasure to have you on the show.
Thank you so much. I appreciate your time today.